JB, hello. So good to see you. Today we are talking Medicare 101, breaking down everything that people need to know. So, JB, why are you and I talking about Medicare today?
Aaron, that's a great question. Always good to see you. The great thing about financial planning and financial pictures, it involves a whole lot more than just your money and your expenses. It
Hmm.
involves your insurance, it involves your estate planning, it involves your healthcare planning and taxes. So that's why we've made it a priority many, many years ago to have a subject matter expert as part of our team, and that's
Right.
Brandon Hill. He knows more about Medicare than anybody I know. He's been doing it for a long, long time, and that's why we make it a priority to make sure people are taken care of.
Yeah. All right. Well, Brandon, it is so good to see you. We have a lot to get to, so let's hop right in. Again, this is your area of expertise. You've been doing this for a long time. So tell us, what is the most common question or misconceptions you hear most?
Yeah, first of all, thanks, Aaron and JB, for having me on today. I
Yeah.
appreciate the opportunity. So, most common misconceptions, and there are certainly many, many of them, but I would say the biggies are in terms of Medicare, there is going to be a monthly cost to it for everybody. Folks that think it's not going to cost them anything. It's not going to cover everything. Original Medicare is going to have many gaps in it that are going to need to be filled, ideally, some form or fashion. There are penalties associated with not enrolling in the right plan at the right time. And also, higher income earners are going to have to pay more for their Medicare as compared to the vast majority of folks. So, those would probably be the most common ones, I would say.
Okay, and then I'm glad you mentioned those penalties because I wanted to bring up deadlines. What dates and deadlines do I need to keep in mind?
So, for somebody who is turning 65, you essentially have a 7 month window around your 65th birth month. Starts three
Hmm.
months before, ends 3 months after, that you can enroll in Medicare A and B and whatever coverage beyond that with no penalties at all. If you work beyond age 65, carry employer coverage. Whenever you leave that employer coverage, you will have a special enrollment period that will let you enroll in A and B without any sort of penalties. But if you do miss those windows, you'll have to enroll during the general election period, which is the first quarter of the year. And by you not having that coverage, in particular for Part B during that time that you have to wait to get into it, you're going to see some late enrollment penalties for your Part B as well as your Part D. So, very important to keep those in mind because those are penalties that will never go away.
Right, really good point. Okay, so now let's get into it. I want to talk through, of course, the four parts of Medicare. We have A, B, C, and D. But I was hoping, Brandon, that we could please start with Part A. What is it?
Yeah, so with Part A, simplest terms, that is going to be your inpatient services. Are you having to spend the night in the hospital after surgery or whatever else it may be? It's going to cover hospice services. It's going to cover care for a limited time, at least in a skilled nursing facility. It's also going to cover home health care, which I think is kind of counterintuitive. People don't think inpatient being in their home, but no, it actually does that. So
Hmm.
those are going to be the four biggies. You'll also have some lab services and some medications while you're staying in the hospital will be covered up under Part A as well. Now, if we go on to Part B, that is going to be your outpatient. Primary among that is going to be your doctor visits, whether it's your PCP, primary care provider, any specialist that you may need to see. It's going to cover durable medical equipment like oxygen tanks and wheelchairs. It's going to cover ambulance rides, many lab services such as your blood work, x-rays, radiology, EKGs, all those types of things. There are a number of things not covered by Part B, though. Most drugs aren't going to be covered by Part B unless you have it administered in the doctor's office, like a vaccine or shot. Uh,
Hmm.
Dental, vision, hearing, routine things for those aren't going to be covered up under Part B. Hospice care is not covered there because it's covered up under Part A. So, plenty of services covered by Part B, but it is not an end all be all by any stretch of the imagination.
Right, and you just touched on this, though. Those medications might not be covered. So let's talk through Part D, please.
Exactly. Original Medicare does not cover Part D prescription drugs at a pharmacy, so you'll have to get a separate Part D card for that as well. So the plan that you pick is basically dictated by the prescriptions that you take. Just look at the cost of the plan plus the cost to get your drugs filled, and that's kind of the plan that you go with. So you'll pick up your prescriptions from a pharmacy, or they'll mail it to your home. Mail order's big nowadays. You'll want
Yeah.
to make sure that they're in network with your plan as well, because if the plan does not have the certain pharmacy in network, you do not want to go to that pharmacy.
Yeah.
So, and it's important to enroll in Part D at the same time as A and B, because there are those late enrollment penalties that are unavoidable and will never go away.
So you can't add it later?
No, not without an
Okay.
enrollment penalty. You can add it later, but you're going to be paying more for
Okay.
waiting that time.
Okay, good to know. I definitely wanted to ask that. Now, there was some movement recently with the Inflation Reduction Act. It changed Part D. What do we need to know?
Yeah, so it did a whole lot of good things. It capped prices of insulin for $35, no more than that, which is huge for a lot of folks.
Yeah.
The donut hole has gone away, which is where a lot of Medicare beneficiaries would spend a lot of money in the prescription drug side of things. That $8,000 former exposure for people across the board has now been cut down to $2,000 across the board, which is huge savings for seniors on fixed income. Also, the government is able to negotiate directly with pharmaceutical companies on some of the major brand name drugs that have really been a problem for a lot of folks. So this is, as we record this in 2025, next year in 2026, the first 10 of those drugs are going to go into effect, with another 15 drugs following in 2027. So more savings coming down the pipe for seniors, which is always a good thing.
Always good news. All right, now let's circle back and talk through Part C, please. Some people say you need it, others say you don't. What do we need to know?
So Part C, that is when a private insurance company is taking over the administration of your Medicare plan benefits. You're not leaving Medicare if you get into an Advantage plan. It's going to combine your Part A and B benefits. Many of them include automatically prescription drug coverage, so you don't have to get a separate Part D card. And many of those Advantage plans are going to cover additional benefits such as your dental, vision, gym memberships, all those types of things that original Medicare does not cover, to make their plan stand out.
And what is the primary difference between a Medicare supplement and a Medicare Advantage plan?
Oh, so that's a bit of a loaded question, Aaron. There's a lot.
That's why I have you on, though.
There's a lot of moving parts in this
Yeah.
sort of thing. So just a quick overarching thought on how I approach these things. You have Medicare that everybody starts out with, and then you basically have two branches of the trees that are very, very different. One is supplement, one is Advantage. People get them confused, but they are vastly different animals, and there are so many different plans available out there, so many different supplements. It's hard to pick. So I strongly encourage people to seek out the guidance of an independent agent. Their compensation is not going to come from you. They can't charge you to enroll, help you enroll in a plan or anything like that. And they will have the knowledge to separate the wheat from the chaff and find the right plan that's right for you. So definitely seek out guidance, because it's a hard beast to tackle on your own, because there's so many moving parts.
Yeah, absolutely. Just deciding between supplement and Advantage. But, as we talk this through, Brandon, it becomes very apparent that piecing together the puzzle for anybody when it comes to any choices with Medicare seems very complicated. How do you walk me through your process? How do you help a client figure out what's best for him or her?
So we start out just looking at what A and B covers, just like we touched on a moment ago, at a very high level, but kind of diving down into that a little bit more. And then saying, all right, if we go the supplement route, you're going to have more comprehensive coverage for your medical care compared to an Advantage plan, but you're going to be paying more accordingly per month for the plan. With an Advantage plan, it's going to be a lot friendlier on the budget, by and large. Many Advantage plans aren't going to cost anything per month nowadays, but you are going to pay more when you go in to receive care. So folks, maybe if you're a healthier person, never go to the doctor, maybe an Advantage plan would make more sense, because why spend that money on a supplement when you don't necessarily need that level of coverage? But if you do have some pre-existing conditions, some health concerns, maybe something runs in your family, who knows, then at least get into a supplement for a time being to start out with, because you can always step down to a lower cost Advantage plan in the future if need be.
All right. Well, I would like to bring JB back into the conversation. JB, holy moly, I can see why you wanted to bring somebody into the office who can specialize in this. Can you just underscore why this decision, healthcare, Medicare, needs to be a part of someone's financial plan?
Aaron, it is vital that the healthcare and medical piece that, is part of someone's plan. It then ties into what is your plan for addressing long-term care and things that may not be covered by Medicare. But Medicare and the healthcare piece is a vital part of people's plans. because you don't want to run out of money. And the interesting thing is, every year, like Brandon said, these plans are changing. Your medicines may change. What worked for you last year might not be the best plan this year. So that's why it's important to talk to an expert of experts like Brandon to figure
Absolutely.
out what's best for them.
Yes. Well, both of you, Brandon, JB, I am grateful for your time today. JB, though, if somebody would like to get a hold of you or Brandon to talk this through, what's the best way to reach you?
Yeah, you can reach us at 803-939-4848 or visit us online at beckettfinancialgroup.com.
All right. Brandon, JB, thank you both for your time today. I appreciate it.
And thank you very much. We appreciate the time.
Thank you, Aaron.